You know the feeling. You've just left the doctor's office. You're clutching a prescription, maybe a referral slip, and your head is swimming with words you can't pronounce. But as you get to your car, that familiar sinking feeling hits. You don't actually have a clear idea of what you're supposed to do next. That confusion is more than just frustrating, it can be downright dangerous. In fact, did you know that studies show patients often forget about half of what their doctor told them the second they walk out the door? In this video, I'm giving you a simple but powerful script, 7 essential questions, that will guarantee you leave every single appointment with clarity, confidence, and a rock-solid action plan. Let's be honest, doctor visits are stressful. The whole thing feels rushed, with the average appointment lasting just 10 to 20 minutes. You're trying to explain what's wrong, the doctor's trying to figure it out, and somewhere in that whirlwind, the important details just vanish. It's a huge problem. People constantly say they feel like their doctor doesn't have enough time for them, or that they leave the office totally lost. Now, this isn't about blaming doctors. They're under incredible pressure. This is about you taking back control. The trick isn't to demand more time, it's to make the time you do have incredibly efficient. It's about switching from being a passive passenger in your healthcare to being an active, informed co-pilot. To do that, you need a system, a framework. These 7 questions will become your personal toolkit for every appointment, whether it's a routine checkup or a meeting with a new specialist. By the end of this video, you'll know exactly what to ask to make sure you and your doctor are on the same page, turning that confusion into a clear path forward. All right, question 1. This is the absolute first thing you must ask before you leave that exam room. What are the key takeaways from today's visit, and do I understand my diagnosis or the results of my tests? It sounds almost too simple, right? But you'd be shocked at how many people nod along and then walk away with no real clue what the main issue is. Your doctor might say hypertension, but you need to know that means high blood pressure. They might mention some findings on a report, but you need to know what those findings actually mean for you. This is no time to be shy or feel intimidated. Your health is on the line. A great way to put it is, just to make sure I've got this right, could you break down the main points for me in simple terms? Or, okay, so the diagnosis is X. Can you explain what that actually means for my body? This prompts a clear, jargon-free explanation and confirms that you're both on the same page. If you don't get this question right, the rest of the plan is built on shaky ground. So you know what's wrong, now you need to know what to do about it. That brings us to question 2. What are my treatment options, medications, or lifestyle changes, and what are their benefits, side effects, and exactly how do I follow them? This is where you get into the nitty-gritty of your plan. It's not enough to just grab a prescription, you need to be a detective. If a new medicine is on the table, ask, how many times a day do I take this? With food or on an empty stomach? What are the common side effects I should look out for? And definitely ask what you should do if you miss a dose. That's a super common mistake. This goes way beyond pills. If your doctor suggests lifestyle changes like a new diet or exercise, ask for the details. You mentioned getting more exercise. What kind of exercise is safe for me and for how long? If you have a few options, try asking this. What would you recommend to a member of your own family? The answer can be incredibly revealing. Repeating the instructions back is also a great way to lock it in. This step is all about making your plan so clear that it's almost impossible to mess up. The appointment ends, but your job of monitoring your health continues at home. That's why this 3rd question is so critical for your safety. What specific symptoms or warning signs should I watch for, and when should I call you versus seeking emergency care? This question creates your if-then plan. If I feel this, then I do that. It helps you tell the difference between a normal side effect and a red flag signaling a real problem. For example, if you're starting a new medication, which side effects mean I should call your office right away? Or if you just had a minor procedure, you could ask, what's a normal amount of pain to expect, and at what point should I become concerned? This is your emergency plan. It saves you from those panicked, middle-of-the-night Google searches and helps you act fast when something feels off. And while you're at it, get the practical info, like the best way to contact the office after hours. Having a clear plan for trouble gives you priceless peace of mind. Good healthcare isn't just about fixing today's problem, it's about heading off tomorrow's. That brings us to question 4. What screenings, vaccinations, or follow-up tests and appointments do I need next? And when should I schedule them? This question shifts your focus to long-term wellness. Your doctor sees your whole health picture, so this is your chance to tap into their knowledge. Ask about screenings relevant to your age, gender, and family history. For instance, based on my age and family history, when should I start thinking about a mammogram or colonoscopy? If you need follow-up tests for your current issue, don't leave without a plan. Ask, when do you need to see me again? And book it on the spot if you can. Leaving with your next step already on the calendar is the best way to make sure there are no gaps in your care. It's how you stay ahead of potential issues. Your health isn't an isolated incident. It's connected to your genes, your lifestyle, and everything around you. Question 5 helps you connect those dots. How does my family history or my overall health affect my risks? And what are the best preventive steps for me to take? This is where you zoom out. If heart disease, diabetes, or cancer runs in your family, now is the time to bring it up. You can ask, given that my father had heart disease, what are the most important things I can do to lower my own risk? This conversation helps you build a game plan that's actually designed for you, moving beyond generic advice. You can talk about the lifestyle changes that will give you the most bang for your buck, whether it's exercise, managing your weight, or reducing stress. Understanding your personal risk profile helps you and your doctor build a strategy for long-term health, not just short-term fixes. Now, I know this is a lot to juggle, especially when you're already feeling stressed or sick in a doctor's office. To make it super simple for you, I've created a free one-page PDF checklist with all 7 of these questions. You can print it out and take it with you. The link is right in the description below. Download it, stick it in your wallet or on your fridge, and use it every single time. Especially if you're dealing with a chronic issue, your main doctor is just one player on a bigger team. This leads to our 6th question. Do I need a referral to a specialist? And do we need to review my full list of medications and supplements? One of the biggest risks in healthcare is when your providers aren't talking to each other. If your doctor suggests seeing a specialist, ask for that referral before you leave. If you're already seeing other doctors, you need to make sure your primary doctor knows what they're prescribing. This is also the moment for a full medication check-in. Bring a list of everything you take, prescriptions, over-the-counter stuff, vitamins, herbal supplements, to every single appointment. Ask your doctor, will this new prescription cause any problems with what I'm already taking? Or should I stop taking any of my current supplements? This review helps catch dangerous drug interactions and make sure your entire treatment plan is working together safely. Finally, your relationship with your doctor doesn't stop when you walk out the door. This last question keeps the conversation going. What is the best way to contact you with questions? And what's the plan if something comes up? Every office works differently. Some want you to call the nurse's line, others use a secure online portal. Knowing the right way to get in touch saves you a ton of frustration and makes sure your message actually gets to the right person. Ask about their typical response time too. After your visit, it's a great idea to review your notes and talk through the plan with a family member or a trusted friend. They can help you remember the details and stick with it. Knowing how to follow up means you can get answers when you need them. It reinforces that your healthcare is an ongoing conversation, not a one-time event. That feeling of being confused and powerless after a doctor's visit is not something you just have to live with. It's a solvable problem. By preparing ahead of time and arming yourself with these 7 questions, you can turn a confusing appointment into a productive 2-way conversation. Let's do a quick recap of the script. 1. What is my diagnosis? 2. How do I treat it? 3. When should I worry? 4. What's next for my health? 5. What's my big picture risk? 6. How do we coordinate my care? 7. How do we communicate after today? You are the world's leading expert on your own body and the most important advocate for your own health. Taking an active role is one of the most critical things you can do for your safety and well-being. Don't ever be afraid to speak up, to ask questions, and to keep asking until you feel confident you understand. You have a right to clarity. If this video was helpful, please give it a thumbs up and subscribe for more tips on how to take control of your health. And now I want to hear from you. What's the biggest challenge you face when talking with your doctor? Share your experience in the comments below. Let's all learn from each other. Stay safe, stay informed, and stay empowered.